Systemic treatments for eczema, part 2.
We also know that we have newer medications now that can act in a very tailored way to control exactly the kind of problem that we are suffering from for a patient with eczema, and that have been sort of designed to do that in a bit of a safer way than these older medications. We know that the first approved medication for atopic dermatitis that was studied specifically is a medication called dupilumab, and this is a medication or Dupixent, that can be injected every 2 weeks, and that can help to just really almost specifically just cut off that branch, that one single branch of the immune system, while leaving the rest of the tree to be very healthy and active. And this is a medication that is very well tolerated and has an incredibly good safety profile, so much so that there's no blood tests required. We also have newer medications, and it's really encouraging for patients that we have new options. So we have a new injection that targets IL-13. It's called Adtralza or tralokinumab, and it's really targeted against this specific molecule that's really the key axis in the skin. We have also a new class of medications called JAK inhibitors. These medications can be delivered either locally to the skin in creams or orally. And we have a new approved oral medication that's really specific for the type of signaling or electrical signals that drive the inflammation in the skin. So it's a JAK1 inhibitor called upadacitinib or Rinvoq, and this is a medication that's taken by mouth once a day that's really great at controlling the disease very quickly and to maintaining that response over time. It is a medication that does change your immune system a little bit more broadly, and so does require some blood tests and monitoring over time. And these are all options that can be discussed and considered with your treating physician.